Month 6, we are closing out the second trimester right now. You are probably starting to feel baby kick and squirm and jab you in there, just the baby saying hello. I'm so glad that you guys are here to discuss month 6 of pregnancy. As a note, as providers, we normally go by weeks, and this is weeks 22 through 27 of pregnancy. It is a very fun time, but there are some specific things that you need to remember as we go through this as well, so stay tuned. Okay, let's go through some of the tasks for you at this point in time. The first one is that your glucose test is probably going to happen during this time frame. Now, most people start with the 1-hour glucose test, which I find to not be bad at all. But if you fail that, which about 1/3 of people do, you move on to the 3-hour glucose test. And I have a whole video on helping you take all of those different kinds of tests. I'm going to link it down below. I see a lot of things on social media saying you do not need to take this test or there's different things that you can do. But right now, it is the best indicator of if you have gestational diabetes. There really is no other way to tell. It is a silent killer. And yes, it does increase your chance of stillbirth and complications for both you and baby if it were to go undetected. Make sure that you're talking with your provider to make the best choice for you in this situation. But I got to tell you, I also see people saying people made such a big deal about this test, and it is not a big deal at all, especially the 1 hour. So just get in there and take it. That's my advice. During this time frame, you're going to want to solidify what your work benefits are going to be as you go and have this baby. Some people may be telling you, oh, it's too early, but honestly, I don't think it's ever too early to start to plan about insurance, maternity leave, things like that. It is going to come before you know it, and you really want to have a lot of these set in place by about 34 weeks should baby come early. So check with your HR, see who you can talk with, call your insurance, things like that. This is the time frame that you are going to want to start your birth class. I recommend starting during this 22 to 27 weeks and finishing by 34 weeks of pregnancy. There is a birth class that I recommend. I'm going to put the link for it down below. Make sure that you are still taking those prenatal vitamins. Now, I know folic acid is most important early on in pregnancy, but you still need to be doing it because that baby is a parasite in there and they will take everything that they leave, leaving you with absolutely nothing. So make sure that you're taking that, and also aspirin if it is recommended. Feel free to ask your provider if they are recommending that you stop the aspirin at some point, but I'm seeing a lot of people where the provider recommends that you take it right up until delivery day. Because remember, aspirin can help decrease your chance of getting preeclampsia. If you've not had that discussion with your provider, it is not too late. You can still start it, talk with your provider, because there are some serious risk factors that they want to review, and it is not right for everyone. Now is a great time to be taking your hospital tour. You might be deciding between a couple of hospitals that your provider goes to, and so taking that hospital tour can solidify that. I have a whole podcast episode on what to do on your hospital tour to get the most out of it. I absolutely love giving hospital tours as a labor and delivery nurse, and I loved answering people's questions about what to expect at the hospital, and every hospital is a little bit different. So even though you're watching my videos here and I've worked at a number of hospitals, it doesn't mean that every hospital where you are acts the same way. So asking those questions can be so helpful. Check with your hospital. Some of them only offer virtual tours, which is still a bit too big thumbs down for me. But if it's the only option, I would still recommend doing it. Okay, what are some tasks for baby? I actually have a whole baby necessities checklist that I'm gonna put the link down below for you guys. You're gonna wanna start to get going on the things that you're going to need for baby. Now, I am here to tell you that your newborn baby actually needs very few things, but figuring out what kind of car seat you want is a great place to get started. Stocking up on diapers, like we talked about in the last video, and just starting to stock up so it doesn't hit you all at once. And time is still on your side at this point in time. It is a great time to stock Facebook Marketplace, look at your local consignment shop, check any used kids' clothes stores around you to start getting the basics at cheaper prices that are also great for the environment. I am a huge fan of using used newborn supplies, things like bassinets. I don't recommend it so much for a car seat, but a lot of the things that you need for a newborn, a front pack, are great to get used. And I personally bought mine used because it's both great for the planet and my pocketbook. And I was a nurse and my husband was a teacher. So we just didn't have a lot of money to spend on that baby. So that is month 6 of pregnancy. I'm going to leave that video up above about how to pass your glucose test, or at least information that you need to know about it. Thanks for joining us here on The Pregnancy Nurse, where we get you prepared, not scared, for your upcoming hospital birth.